testament to resilience, a story of strength, healing, and hope. We go beyond treatment to redefine what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Oak Mountain Academy is a vibrant community built on innovation, academic excellence, and a 64-year legacy of shaping community leaders. I'm Patrick Uran, head of school at Oak Mountain Academy, inviting you to visit the mountain and experience firsthand the passion, purpose, and personalized education that defines our school. Come see how our mission and vision come to life each day. For more information, visit us at oakmountain.us so that you can discover your journey on the mountain, where every path leads to purpose.
National headlines and the local stories you care about. WLBB, Carrollton, News Talk, 1330, FM 106.3.
Good morning. Welcome to the Community Voice. I'm Steve Graddick, your host. Delighted to have you with us. It's a great day. Thank you for joining us. We thank you, our sponsors, Oak Mountain Academy and Tanner Health System. Very pleased, honored to have in studio Marcy Heath, Insurance Solutions of the South. This is her 15th appearance, I believe, annual appearance. So welcome. So we got a little intro here. Marcy Heath is a seasoned health insurance expert and entrepreneurial leader with more than 28 years of experience in the industry. She founded Insurance Solutions of the South in 1997 and has grown it into a respected firm serving individuals and families across Georgia and Alabama. Under Marcy's leadership, the company has earned a reputation for integrity, trust, and genuine client care, offering a wide spectrum of health insurance options, Medicare solutions, and life, dental, vision plans via nationally recognized carriers such as Anthem, Cigna, Humana, Aetna, and United Healthcare. Well, with that, again, good morning.
Good morning.
You're here, and we love bringing you back every year, and we do it kind of around this time because ever since Obamacare came into being.
Open enrollment starts on November the 1st.
Which is Saturday.
Yep.
And so tell us about that, and I'll just let you kind of take it from here. There's a lot of buzz, a lot of interest, a lot of discussion, and most people, particularly myself, don't have a full understanding of all the ramifications of it. So bring us up to date in the year 2025.
So there is a lot of confusion this year, in Congress talking about, the premium tax credits. The premium tax credits are set to expire at the end of the year if Congress doesn't do something.
Can I interrupt?
Yes.
Now, there are two types.
There are two types.
We're going to get deep into the weeds. I just know it. But,
yes.
Okay, go ahead.
So there are two types. So when the Affordable Care Act was passed in 2010, that set the stage for the marketplace, which launched in 2014. Now, with the ACA passage, you had premium tax credits. And that's what everybody pretty much had until we hit the pandemic in 2020. So when Biden was in office, the American Rescue Plan Act, and then later extended by the Inflation Reduction Act, they had the enhanced premium tax credits. And so what that did is that temporarily removed the income cap for advanced premium tax credits. So like say a family or an individual that has an income of 400% of the federal poverty level, they were not able to receive any type of tax credit because their income was too high. And so that basically reduced reduced individuals,
The number of individuals.
Yeah.
Okay.
And so with the passage of that then allowed people making 400% to be able to get, premium tax credit. And it also kind of richened the premium tax credits for people that fell below 400%. So it's not the actual premium tax credits, that was passed through the Affordable Care Act that is in danger. It's the enhanced premium tax credits. And it's a big deal.
I have not heard about the enhanced or that word attached to it.
So that was what was passed during the pandemic, and so under the American Rescue Plan, it was passed, and then of course it was extended. But Democrats set for it to expire at the end of the year,
right?
And so I think that's some of the back and forth, going on in Congress.
We hit on something. So that's interesting. So if the enhanced credits passed under the so-called rescue plan, is it a big of a deal?
It is a big deal.
Okay, so it's still a big deal.
It is a big deal because now, you've had, 5 years? So 2020 is when the pandemic hit. And of course, that's when the enhanced premium tax credits was passed and implemented. And, it made health plans affordable. Well, stripping that away and going back to the original premium tax credits is going to be detrimental because you've had 5 years of carrier increases. And so the premium tax credits kind of offset that. And now if you're taking premium tax credits back to the original set, insurance premiums are going to be high this year.
Now, when you say high, give us a guesstimate. I mean, are we talking about, I read somewhere that they might even double.
So insurance carriers went up between 15 to 20%, and that's across the board. And of course, if you've got the premium tax credits that, are going back to the original state, I would say you're going to see premiums doubling this year. And here's the bad thing is that Congress has until the end of the year to decide on if they're going to extend the premium tax credits. So while we're going through open enrollment, if we give you a price that's doubled, if they end up extending it, then the price is going to change. So it really makes the work double, for us, because we're in an uncertain time right now.
Well, and that uncertainty tends to, it shouldn't be as uncertain as it is, because I read again that basically if they would just adopt right now a $400 billion package, plus or minus because of interest on the debt, that they could extend it. But yet all we hear about is 1.5 trillion. So it's really only 400 billion that they would have to come to terms with or negotiate out. To keep everything rocking and rolling with the Obamacare, right? Right.
So prior to the pandemic, the federal health insurance assistance cost us about $52 billion. And through the pandemic, with the enhanced premium tax credits, it increased to $110 billion in 2024. And of course, we don't have the numbers for 2025 yet.
Well, you and I, 15 years ago on this program, talked about, and I heard a quote from President Trump that Obamacare will never work. It hasn't worked, and it will never work, or something to that effect. And we tried to warn. So it's really, it's just not practical, is it? Or has it proven itself practical?
So as long as you have the premium tax credits to offset, the increases from the health insurance carriers, it's doable. But, I always go back to the biggest lie ever told was if you like your doctor, you can keep your doctor.
Right.
And the whole ACA was supposed to have opened up the market to where, it's kind of like the way that Obama explained it was it's kind of like, one of those like bookit.com. You could go in and you could check, all these insurance carriers' prices. Well, that came out to be totally untrue. Prior to the ACA, we had like 7 or 8 individual insurance carriers. Now we have 2 in our area. We have Alliant and Blue Cross and Blue Shield. And, as the ACA continues going on, the plans are decreasing in benefits. And of course, prices are going higher.
And some would say the whole design of it was to get insurance companies to go out of business so the government would be the single pay, quote unquote, single payer socialist medicine. Before we go to the first break, let's go back. So the insured now are facing significant increases. So what are they to do in this environment?
So in this environment, we've got other options that we can look at. I know back a couple of years ago when we were facing, increases in health insurance, and, some people just couldn't afford it. So we've got other options. I still go back to, if you can afford something through the marketplace, you can at least get like a catastrophic plan. And do like a DPC arrangement, which is a direct primary care.
There were several years where that was recommended.
I'm not exactly sure who all. I think 316 at one point did. I'm not sure if they're still doing it. But U.S. Med Clinic, is local. They have a place in Carrollton and Villarica. They offer a DPC arrangement, and you can couple that with a catastrophic plan, and have decent coverage.
So it's just like your power bill. If the power bill goes up, you got to pay it. And if you're going to take care of your family or even yourself, you need health insurance.
And here's the thing: we always tell people, we're always telling people you need to shop your insurance. But when it comes to the marketplace, if you go to me or if you go to somebody down the street, you think that my prices are too high, and you decide to go to ABC, insurance agency down the street, they're going to have the exact same prices as what we have. So it's uniform, just as long as they have the exact same, family makeup, how many dependents you have, and your income, the prices are going to be the same, across the board.
So if someone loses their coverage for a period of time, how do you assist somebody like that? And they go like, I'm sorry, I just can't afford it. It's not in the budget. And
a couple of years ago, we did have, that situation, and of course we tried to get them a policy off the marketplace. And I always go back to the catastrophic coverage, because if you're going to sit there and be uninsured, you can at least, a catastrophic coverage is maybe $150 to $200 a month. And that will at least protect you against the big stuff. Like if you have a car accident, or, you are diagnosed with cancer, or, have a big hospital bill, that will at least protect you from that.
Okay, we're going to take a break. We've got Marcy Heath, Insurance Solutions of the South, and we're going to continue to talk about, I guess we could call it the health insurance crisis of 2025. Yeah. We'll be back with more after this.
Imagine a place where every heartbeat is monitored with the utmost care, where emergencies are met with swift attention, and where cutting-edge technology enables precise and timely treatments. At Tanner Health, every patient's journey is a testament to resilience, a story of strength, healing, and hope. We go beyond treatment to redefine what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Do the math. At Oak Mountain Academy, our average graduating class has just 12 students. We celebrate a 100% graduation rate with more than $10.5 million in college scholarships offered. Plus, 96% of our students are accepted into their top choice college. Do the math. Can you see the value of an OMA education? I'm Patrick Uran, head of school at Oak Mountain Academy, and I'm here to help you do the math. For more information, visit us at oakmountain.us so that you can discover your journey on the mountain, where every path leads to purpose.
Good morning, welcome back to the Community Voice. Marcy Heath, Insurance Solutions of the South. We're talking about, I'm not sure anybody finds health insurance their favorite topic.
No.
I didn't think so. Okay, well, with that said, it's not just the enhanced premium tax credit, the tax credit, the premium tax credit issue, but there are other things going on with health insurance this year.
Yes. So the Big Beautiful Bill was passed. It had a section in it, which is, they call it the MIA rule. It's the Marketplace Integrity and Affordability rule. So you've got some of the changes that came down from like CMS, and Georgia pulled away from the marketplace.
What's CMS?
CMS is like your federal government.
Oh, okay.
Yeah.
CMS.
It's Center of Medicaid and Medicare Services.
Oh, Center of Medicaid, Medicare.
Yeah.
Okay, well, I'll get you back on an FCC topic at some point. Okay, go ahead.
So I lost my train of thought. Anyway, so some of the changes, that have came down through the marketplace, Georgia exited the marketplace, opened up their state-based exchange last year. So some of the changes that Georgians will not see, but some of the changes we will see, and that is one, data matching issues. They call them DMIs. So if you have like an income data matching issue or Social Security, they're going to send those out to the consumers. You have 90 days to get that information in. They used to have an automatic 60-day extension. That's going away. So you've got to be on top of getting your documentation in. If you don't get it in within the 90 days, you lose your premium tax credit of what you get.
That sounds terrible.
Well, it's not anything new. They've always had, data matching issues. If somebody puts their income at, 25,000.
Well, it sounds terrible in the sense it's like, bureaucratic paper, fill out this, fill out that. I just want some health insurance. Leave me alone. I got a life to live. You know what I mean?
Right. So, it's not anything new. It's just something that, that consumers are going to have to really pay attention to.
But you can assist with all that.
Oh, yeah. We always assist with that. So that's the one thing. Changes to repayments of the federal premium tax credit. Previously, there was a limit on how much income consumers had to repay back if they underestimated their income. Yes. So if you received more premium tax credit than you should have with your right income, when you file your taxes, that's when you do the reconciliation to where you would pay back what you should not have gotten. So due to income, if you were lower income, like say 150% of the federal poverty level, the IRS did not make you pay anything back. That is all changing. Everybody has to pay back if they underestimate their income. So that's the second change. Immigration status, due to the policy change in H.R. 1, lawfully present immigrants within their first 5 years of residencies will no longer be eligible for the premium tax credit through Georgia Access. And then also DACA recipients are no longer classified as lawfully present immigrants for the purpose of enrolling through Georgia Access coverage. So there's, changes to that.
That's a whole topic in itself.
Right.
That I don't know that we have time to get into.
And then also SEPs, which is.
But that did sound like there were additional restrictions on legal immigrants, correct? Mm-hmm. Okay, go ahead.
Yes. So SEP, which is your special election period for consumers with incomes below 150%, they could come in without proving like a qualified event. That's going away. That actually ended on 8/25.
Say that again. I didn't get that.
So if you were at 150% below, if you were below 150% on the federal poverty level, you could actually come in to the marketplace without proving a qualified life event.
Really?
Right. So that is going away. So everybody, no matter where your income range falls, everybody's going to have to prove a qualified life event.
And what would that be? What is
so that would be like death in the family, marriage, birth, divorce, losing coverage. Like if you worked for a company that offered insurance and you were terminated or you quit and you lost your insurance, that's a qualified event to be able to come into the marketplace.
And that's required to get into the marketplace?
Yes. If you do not enroll during open enrollment, so anybody can enroll.
Take a minute to explain that. We got open enrollment, and then if you don't participate in open enrollment, as far as getting into the marketplace, you're done.
You're done. And the only way that you can come in now for 2026 is you have to have a qualified event.
Okay.
Yeah. So the marketplace is open to everybody. You don't have to worry about any kind of qualified events.
Okay, I see.
Right.
And so that the H.R. 1 or whatever it was, the big beautiful bill, that qualified that or clarified that.
Yes, that implemented that.
That made that just clear as day.
Yes. And so now another change with HDHP, which is high deductible health plans. If you couple that with an HSA, you can now use your HSA dollars to pay for a DPC, which is direct primary care.
Yeah, expand on that because, we've been asked about the health savings account and how it's impacted about all that's going on. So what's the 2025 latest and greatest on health savings account?
So health savings account is a great tool. It's not for everybody. But it is a great tool to attach to a high deductible health plan. You can put money in there tax deferred, pull it out tax deferred. If you don't touch it, it sits there. It's kind of like an IRA. It grows.
Is there tax advantages or tax penalties for using it?
So there's tax advantages, because every dollar that you put into your HSA, of course, comes off. That's the first thing that comes off in your taxes.
Okay.
And then you can pull that money out and pay for medical services and not have to pay taxes on it.
Okay.
But, they were really restrictive as far as what you could pull money out of your HSA to pay for. It does cover more things than what just like traditional health insurance covers. So I think at one point in time you could pull money out to pay for a gym. You can pay for, vision, you can pay for eyeglasses, there's just a lot of things that falls under the HSA guidelines. But they are implementing the DPC, which is really important because everybody knows with a high deductible health plan that you don't have any copays. So you're basically paying your deductible. And then once your deductible is satisfied, which those are usually pretty significant, $3,500, $5,000 or higher, then you would start getting, then you would start getting coverage. So being able to add a DPC.
And DPC stands for what?
Direct primary care.
Okay.
So being able to pull your money out from an HSA to pay for DPC is huge because a direct primary care is going to give you, there's several different options that you can choose. I think they have levels 1 through 4. And then of course 4 is covers blood work and your yearly exams and stuff like that.
Yeah, speaking of blood work, this whole thing's making me dizzy. I don't know. All right, so we're going to have to take another break. But now explain to me, so we've got open enrollment November 1st, starting Saturday until December 15th.
Right, and that's for a January the 1st effective date. Now, open enrollment, a couple of years ago, they extended it to January the 15th. So you can still enroll after December the 15th, but if you enroll after December the 15th, then you have a February the 1st effective date. So if you need coverage January the 1st, your deadline's December 15th.
So how does this shutdown affect open enrollment?
Well, I go back to, the enhanced premium tax credits are sitting there kind of looming. So, as I said,
it may mean if they change their mind that you just have to redo everybody's.
We'd have to redo everybody's.
Oh, well, yeah. Gee, that sounds efficient.
Yeah. So, and like I said, they have until the end of the year, to okay it or still be in a government shutdown.
All right. Well, that's exciting. All right, we're going to take our next break, and we'll try to come back with more with Marcy Heath, Insurance Solutions of the South, after these words.
Imagine a place where every heartbeat is monitored with the utmost care, where emergencies are met with swift attention, and where cutting-edge technology enables precise and timely treatments. At Tanner Health, every patient's journey is a testament to resilience, a story of strength, healing, and hope. We go beyond treatment to redefine what compassionate care truly means. That's Tanner Health. That's care redefined. Learn more at tanner.org.
Oak Mountain Academy specializes in a customized designed academic approach tailored to meet the needs of our families. Our lower division prepares students with the necessary foundation to build excellence. Our middle division provides students with over 15 course offerings, providing them with opportunities to explore their talents and gifts. Our upper division provides personalized academic journeys, allowing them to achieve their dreams. I'm Patrick Uran, head of school, inviting you to journey with us. For more information, visit us at oakmountain.us, where every path leads to purpose.
Good morning. Welcome back to the Community Voice. Marcy Heath, Insurance Solutions of the South. This is your profession, obviously not mine, and most people, barely keep up with this, and I assume so. But,
yeah, this is, I've been in insurance for 28 years. I started when I graduated from high school. And, it's just always been a passion of mine because health insurance is very complex, and being able to, sit down and simplify that for, an individual or a family or even an employer, has just always been a passion.
But don't get me started, because right now after Obamacare, the number of employers offering insurance now has dropped, I would assume. Or is it about the same?
It's about the same.
How are they pulling it off? How has that changed? I know we're running out of time, but go ahead.
So, when the marketplace first, opened up in 2014, you did have a lot of small employers that decided they wanted to, drop it and let everybody go to
the marketplace, the way it was presented.
But now with, the restrictions, a lot of employers, especially that have, employees outside of Georgia, or, they have, employees that travel the country, for sales or whatever, it was not reasonable for them because Georgia Access only covers in Georgia. You do not have coverage in Alabama. You don't have coverage in, any other state in the U.S.
Well, let me ask you about that, because I certainly don't understand it. We have Affordable Care Act, Obamacare on the federal level, and then all of a sudden somehow it popped up in Georgia that we have a marketplace in Georgia, i.e. Kemp Care. What in the world's going on?
So, when the Affordable Care Act rolled out, Georgia was pretty much said no. We're not gonna do a state-based exchange. I don't know why, but over the years, so the state of Georgia actually had to pay to be a part of the marketplace. And so they wanted to be able to save that money. But the thing that gets me is, it's just like when Obama was pushing the Affordable Care Act. It's like, oh, we're gonna enrich your experience. We're gonna have all of these different options. We're gonna have all these different insurance carriers, which you would have thought from it being handled on a on a state
more responsive,
that you would have been able to do that.
But that's not.
But that's not it. It's just exactly like the marketplace. There's no changes. We don't have any other options.
So why is the state doing it?
So they wouldn't have to pay to be a part of the marketplace.
I guess that must have been a lot of money. I don't know how much.
Yeah. So last year, Georgia Access enrolled, I think it was like 1.38 million members. Of course, due to premium tax credits, the uncertainty on that, and the increase in premiums, I think that number's going to go down significantly.
Okay, well, that clears all that up. Tell us about, you've got 2 offices now.
I do. So we still have our office in Bremen at 206 Hamilton Avenue. We are located in the Bremen Executive Suites. And then I just moved my Villarica office to Carrollton back in June. So we're at 208 West Center Street. And we look forward to seeing you. And
to schedule an open enrollment appointment, you need to schedule an appointment.
Yeah.
So an average appointment lasts what, 30 minutes?
About 30 minutes.
Yeah. Wow. So what's the phone number?
So our telephone number is 770-537-5300.
Okay. So you got the convenience of either Bremen or Carrollton.
Right.
And website?
So it's Insurance Solutions of the South.
.com. .com. All right, good deal. Anything else you want to mention? We got about a minute left. Just come on and see me, and we'll try.
Yeah, just come on and see us, and just make sure if you do your plan yourself, or if you go through another broker, you just need to make sure that you have all of your information correct.
But right now, you got to sign up thinking the tax
credits are going to go away.
Yeah.
Right.
And that's got to be a nightmare for a lot. Particularly, I don't have a family, but if you had a family, I'd just be like through the moon or whatever, to the moon. All right, good deal. Well, thank you for coming in.
Thank you. I appreciate it.
It's good to see you once a year. I never see you outside of this, so it's a pleasure. And congratulations on your move and your expansion. And I understand you're also, real quick, you've got some sort of boutique.
Yeah. I do.
What's the name of it?
So I opened up a boutique. It's Bougie Blonde Boutique, and it's located at where Insurance Solutions is at 208 West Center Street.
Our gratitude this morning to Marcy Heath, Insurance Solutions South. Go out and make it a great day. You're in tune to WLBB Carrollton.